Say, health insurance can feel complicated, but it can be made simple to understand, starting with commercial insurance, the kind of plan you might get through an employer. First is the monthly premium. Think of this like a subscription to a streaming service. It's a fixed amount of money you pay every month to keep your insurance plan active. You pay it even if you don't see a doctor, just to make sure the coverage is there when you need it. Next is the deductible. The deductible is the amount of money you have to pay for your own medical care before your insurance company starts to help pay. For example, if your plan has a $1,000 deductible, you pay for the first $1,000 of your medical bills yourself. After you've hit that amount, your insurance starts sharing the costs. Once you're over that hurdle, insurance doesn't always pay for everything. That brings us to the out-of-pocket limit. This is the most important number to know because it's your financial safety net. It is the absolute maximum amount of money you will have to pay for covered medical services in a single year. Once your payments for deductibles and other services add up to this limit, your insurance plan pays 100% of your covered medical bills for the rest of the year. Now, let's talk about medications and tiers. Medication tiers are how insurance plans group prescription drugs to decide how much you'll pay. Think of it as a ladder. Tier 1 is the bottom rung, and it's the cheapest. Tier 2 is the next step up, and Tier 3 is even higher and more expensive. For example, a common generic drug for cholesterol would likely be in Tier 1, and your cost at the pharmacy might be just $5. But a new, brand-name-only drug will probably be in Tier 3, and your cost could jump to over $100 for the same one-month supply. So how does this all work with Medicare? The concepts are very similar. Medicare is the federal health insurance program mainly for people who are 65 or older. Just like commercial insurance, you have a monthly premium for Medicare Part B, which covers doctor visits. There's also a small annual deductible you have to pay before Medicare starts covering its share. However, there is one most important difference. Original Medicare Parts A and B do not have an out-of-pocket limit. This means there is technically no cap on what your medical bills could be in a worst-case scenario. That's why many people choose to get a supplemental plan, like a Medigap or Medicare Advantage plan, which add that crucial out-of-pocket protection. For prescriptions under Medicare, you enroll in a Medicare Part D plan. And just like commercial plans, these Part D plans use medication tiers. A Tier 1 generic blood pressure pill might cost you just $1 or $2. But a Tier 3 or a specialty tier medication, perhaps a newer drug for managing diabetes, could cost significantly more. So, whether it's commercial insurance or Medicare, understanding these 4 key ideas, premium, deductible, out-of-pocket limit, and medication tiers, is the foundation for making smart decisions about your health. It empowers you to know how your plan works and what to expect.